poso maoni wiak, waiwanan kitana ni mua, yoski piataya posnotaman yom MITW Podcast. Yos piataya posnapi notaman, and a hisikimaka yoso matnamin kihi.
Welcome to the Menominee Indian Tribe of Wisconsin podcast. We are your hosts, Gary Dodge
and Sheena Wapus. On this episode, we are, as usual, joined by guest Vaughn Bowles, and he is the Public Information Officer for the Incident Command Center for the Menominee Indian Tribe of Wisconsin, and he is here to answer some of our COVID-19 questions. I would like to remind everyone that we welcome community questions or topic suggestions, and we request that you send those to us at podcast@mitw.org.
All right, first question is, what is the number that surrounding counties need to reach before we start to shut down again? We've seen the number of cases in Shawano County getting higher.
That's a good question. Thanks, Gary. So we don't have a hard and fast number, so we're not saying, if we see 20 cases pop up, we're going to shut back down. In the tribe's back to action plan, it was one of the things that we addressed, and it was based on the percentage of positive tests being run to those that are actual positive cases of COVID. So right now, Gary, like you mentioned, the Shawano cases have been going up. However, the number of positive cases have been below that threshold. It's about 10% and stuff is what we're looking at for number tested positive. So as long as the ratio of people being tested is still below that 10%, we're not too worried about pulling the tribe's employment and economy back and moving back to our phase one where everyone's working remotely again. So right now we're still at a phase two capacity where we can have, half of our employees on site and we can still access the buildings by appointment. So until we see another spike, either in Shawano County or Langley or Oconto County, we'll be able to maintain operations within the tribal buildings at least. It may be different for the Menominee County buildings, but right now that's how we're operating.
So basically, if it's the number of tests like per day or something like that, so you have a certain number negative and a certain number positive. Is that what you're saying?
So it's a percent based on the number of positive tests per day. I think actually we're looking at it on a weekly basis, but we do track the daily count. But yeah, it's percent positive versus those percent tested.
Got you. So I had my mom actually asked me this question this week. So does the mask resolution that was passed for the Menominee Reservation, does that have like consequences or like punishments for people who aren't following this the guidelines?
So I'm glad your mom asked. We did talk about this a little bit. We can definitely cover it again because I think it is important. So the mask resolution right now is just a resolution. It was passed that way so it could quickly go into the environment or the community. Right now, it doesn't have any sort of consequences like fines or jail times attached to that because we wanted to pass it and assume that everyone in the community was going to be willing to help protect the elders and those that might be at risk, that might be immunocompromised in any sort of situation. Now, that said, if, I see and Dr. Schlegel and those at the clinic find that, not enough people are wearing masks, the incident command team, working in conjunction with the Menominee Tribal Legislature, can go and produce an ordinance, which would be a more binding legal type of law, I guess you could say, that would have consequences attached to it for non-compliance. But that's kind of a last resort type thing. We don't want to impose new laws on everyone that restricts their freedoms or makes their lives overly difficult. That said, let me throw this out for people to consider, and here's why the mask usage is important. This last week we had an individual who works outside of the reservation boundaries test positive for COVID-19. They also live with a couple elderly relatives who incidentally were infected as well. There is a period before symptoms show up. It's called a latency period, where people can still pass the virus to others. And because these 3 individuals didn't know they had COVID, there are 16 other individuals on the reservation that are now quarantined and being tested to find out whether or not they were exposed beforehand. So bringing that back to mask usage, the masks have been shown to cut down on the spread of disease. There are studies out there where, mask usage, like continual mask usage of specific types of masks, aren't great for people because it can increase the amount of CO2 they're breathing and also can, trap viral particles within the mask. But those are kind of rare, and it's better for individuals to be using those so they expose fewer people within the community to the virus. And so we'd really like to encourage you all to use masks, especially when you're out and about, so we don't accidentally or randomly expose, someone who might be at a higher risk level, one of our seniors, or those with, underlying health conditions. So there aren't consequences, but please be kind to others right now.
All right. If the numbers in the surrounding counties keep climbing, is there a possibility the tribe will close its borders as other tribes in the nation have done?
So Wisconsin has a different arrangement legally with its tribes than some of the other Native American and Indigenous peoples do with theirs. From what I understand, technically the tribe isn't allowed to close down any state highways. And so we couldn't fully close off the reservation. That said, I did contact our legal department about that. We're still trying to get concrete answers for you. If you'd like, we can bring this up again. So right now, we would have a semi-permeable border if things got really bad and we moved back to a phase 1 and closed down more of the tribe. But we couldn't block it off entirely. So at this point, the answer is no.
So I've seen this argument quite a bit online. So is it true that the actual number of coronavirus cases aren't getting higher? It's just the fact that we are testing more.
So that's an interesting question, and I gotta tackle it from 2 sides.
Okay.
Are we testing more? Yes, we are testing more. Are we finding more positive cases because of it? Yes, we are. That said, is it because we're just finding more? Not necessarily. The virus is out in the wild and it is spreading, so there are more people contracting the virus. Mm-hmm. That said, if you look at our testing, unlike Wisconsin Department of Health, they have a specific website where they track this. The number of total cases has gone up kind of in a linear direction. It's basically a straight line. That's not how viruses spread in real life. If they have what's called an R0 value of more than 1. R0 is the number of people that can get infected. They think that COVID has somewhere between like a 2 to 4-ish R0. So for every 1 person that gets infected, they'll infect on average 2 to 4 more people. Not necessarily the case. Some person could go somewhere like, church or work and infect dozens of people. Could happen. They're just saying that's the average. Well, the type of growth you see with that is called exponential growth. And instead of more of a straight line, you get people describe it as kind of a hockey shape where there's kind of a low period in the very beginning, and then it kind of shoots and rises at a fairly high rate. And sorry, I'm talking with my hands now. I realize this, and this is a podcast, so you can't see that. I apologize. But so our testing abilities haven't been able to keep up with an exponential type growth. Studies that were produced by multiple universities across the country estimated that the actual number of cases of coronavirus are between 10 and 30 times higher than our testing capacity right now. So it's out in the community at a much higher rate than we can find. We're just now catching up to it though, and starting to be able to find more of those cases. So it is out there and it is spreading, but we are testing more and we are finding more of it. So it's not that, it's all because of one thing or the other. It's a combination of both of those things.
All right. So what can the youth do to help our elders in the community during this time?
So the biggest thing that we can encourage youth to do is focus on reducing the spread of virus, because they don't know whether they're an asymptomatic carrier or, if mild symptoms they may have at this time are things like allergies or colds or flus, because there are summer flus and summer colds, or COVID. So, we'd ask that they would participate in the things they would normally do to reduce the spread of viruses. In this case, wear a mask, wash your hands frequently, keep physical distance between yourself and others, and, avoid large groups of people that are confined in enclosed spaces, and avoid, community type food and stuff where you'd be eating out of the same dish as, multiple people that aren't members of your household.
So we had kind of talked about vaccines a little bit. Was there some things you wanted to talk about regarding that?
Yeah, sure. So there's been a lot of talk about vaccines, and really quick, we should back up and talk about what a vaccine is. So when the body gets infected, it has two types of immune response. One is that it builds antibodies. That's the one most people are familiar with. And the other is that it builds up a T cell or a white blood cell immunity as well. The idea behind using a vaccine is that you can trigger both of those responses without making the person sick. So they can do this either by injecting what's known as an attenuated or a dead or an inactive virus, or they can make artificial components of the viral capsule. And the goal is to trigger an antibody response or a T cell production. Right now, they're having real issues finding vaccine solutions that keep antibody production high. They've been finding that antibody production drops off fairly soon after exposure to COVID. That said, University of Oxford and AstraZeneca have been working on a specific vaccine that triggers both an antibody response and a T cell response. They've actually had some pretty good success with that. And so they're moving to what's known as phase 3 trials. Those are going to be human trials. They're going to be large scale. And the only issue that they may find with that is they're going to need around 30,000 volunteers for this. And that's what part of the reason why vaccine production is so slow. They have to demonstrate in the beginning that it has in vivo capabilities and in vitro capabilities. So they have to make sure that it works first in a lab and in a controlled environment. Then they have to make sure it works in a living environment, which is the in vivo. They'll start with small cells. They'll move to small mammals like mice that have immune systems that are pretty close to ours. They're like 94 to 96% similar to a human immune system. And then if they find that the vaccine is successful there, they move to small scale trials. Well, Oxford and AstraZeneca have finished their small scale human trials, and so now they're moving to their large scale trials, which is good. It's great news. It's just going to take them a while to come up with their results because they have to train doctors and personnel and lab technicians all to carry this out very specifically so they can get conclusive data regarding whether or not the vaccine is going to work. That said, there are some large-scale tests taking place around the world. In the UK, South Africa has a couple going on, and Brazil has some going on as well. Israel has also made some very good progress in developing various vaccines. And the United States has put, it looks like $3 billion into COVID vaccine development right now. So they're making a big push to make that happen. But because the large-scale test takes so long, it's looking like the vaccines won't be ready until about 2021 at the earliest. So that said, they're making progress, but it's going to take time because science takes time. So just an update on that.
So the large scale trials, is that basically the last step then?
Yeah, usually it is. We're pretty close to it. There may be additional need for peer review where other doctors and laboratories go back and be like, let's see if we can reproduce their results. But in the most cases, when they move to large scale testing or third phase testing, that means they're pretty close to production. So depending on the type of vaccine they're making, sometimes there's a fourth and fifth trial afterwards. But the fact that they've reached this point is tremendously good news for not just our country, but the world, I think.
Thanks for the update, Vaughn.
Yeah, you bet. Thanks for having me back, guys.
All right.
Is there anything else you'd like to add?
Be safe, be healthy, get some vitamin D that actually has been proven to help fight off the coronavirus. So get some sunshine and enjoy some time outside with family.
Is that just a mental effect or?
No, that's an actual thing. So vitamin D is one of the vitamins that helps regulate your immune system. And if you have too low of levels, it actually stunts your body's system to fight off viruses. So yes, getting out and getting sunshine helps your immune system. It's also been found to help your eyes, which is a science I don't totally understand. Don't stare at the sun, everyone. I'm not saying that, but it does help your vision as well to get outside for a while.
Oh, wow. Well, that's cool. And now I have an excuse.
Yes, exactly.
Okay. Waiwanan for listening to the Menominee Indian Tribe of Wisconsin podcast. You can find us on Apple Podcasts, Spotify, and Stitcher. You can also listen to the podcast on menominee-nsn.gov under the Community tab and keep up to date by following us on Facebook at MITW Podcast. And as I mentioned before, we are doing weekly episodes with Vaughn, and we do want you to send your questions and topic suggestions in to us so we can talk about them with him. So please send those to us via email at podcast@mitw.org.